Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then cardiac resynchronization therapy. This cardiac resynchronization, approximately one-third of the patients with decreased ejection fraction and those who are symptomatic, they will actually have a QRS duration of more than 120 milliseconds. So if you do an ECG, if the ECG shows that there is either if the in the ECG if there is abnormal inter or intraventricular conduction. In the ECG, if we see abnormal inter or intraventricular conduction, this is actually used to identify the patients with Dysynchronous. By this inter or intraventricular conduction, we can identify the patient with dysynchronous ventricular contraction, that is some difficult or some different or abnormal ventricular contraction. That is, if all the ventricle, actually normally the whole of the ventricle will contract at the same time, but if the whole of the ventricle is not contracting at the same time, that is called as dysynchronous. So this dysynchronous ventricular contraction can be identified by abnormal inter or intraventricular conduction. So mechanical consequences of this ventricular dyssynchrony. Now, because whenever there is ventricular dyssynchrony, what happens? Whenever there is ventricular dyssynchrony, then this will result in suboptimal ventricular filling. That is, ventricular filling is not happening properly, and when the ventricular filling is not occurring properly, there will be decreased left ventricular contractility. This decreased left ventricular contractility will result in prolonged duration of mitral regurgitation, and also there will be paradoxical septal wall motion is also seen. So overall there is problem in the heart completely. So during this time we can do a biventricular pacing can be done, or this is also called as cardiac resynchronization therapy. Biventricular pacing or cardiac resynchronization therapy is done, and this will stimulate the ventricles simultaneously. It will activate or stimulate the ventricles simultaneously. When the ventricles are stimulated simultaneously, so this will improve the conduction of the ventricles, or actually it will improve the contraction of the ventricles, and thus it will reduce the mitral regurgitation.
thank you and thank you for watching.